There's several patients will have two different kind of major sleep issues. Several different sleep issues. So one is sleep apnea, and that's a dangerous condition where their airway closes off and their brain isn't getting as much oxygen that it needs. A lot of times it used to be that your wife would complain about you snoring. She'd end up sleeping in the other room, or your husband, or vice versa. But now we're realizing that that's one of the biggest risks for AFIB, for strokes, for being exhausted and tired during the day, headaches. And my husband was diagnosed with sleep apnea. So they have these CPAP machines, and it's this huge machine with a tube. And the first night he gets in bed and puts this on, and you're like, that is really attractive. And halfway through the night, the tube is wrapped around his neck, and he's sleeping worse than he was before he had the machine. So I had taken a couple courses then on how to make these sleep appliances. And essentially what it is a simple mouth guard that fits into your mouth. It's custom made so it fits nice and tight, and it opens up that airway. As the research has progressed in the last couple of years, then the American Sleep Association is starting to heavily start to support those, because patients, they're much more comfortable than the CPAP, and patients are much more likely to wear them. So we're starting to, initially we were providing it for my husband, for our staff members, and then we decided to extend that out to patients. And we've had a lot of people really happy with that service. The other sleep appliances that we do are, we have a lot of patients who clench and grind. The issue is you get to the point where all of a sudden you have teeth, you haven't had a lot of cavities, you start cracking teeth or breaking teeth. The last thing you want to do is start losing teeth when you're 30 from clenching and grinding. So we make a lot of special appliances that protect the teeth so that they take the force and not your teeth.